of violence nurses are seeing are really anything that falls into the category of assault. So being punched, being hit, being threatened. We had a nurse on the floor who had to deal with a patient with a knife. Also, there are reports of sexual assault. So really anything could happen to a nurse or other healthcare worker. There was just a report out that healthcare workers, and I'm sure that nurses are a big group of that because they are the biggest group of healthcare workers in the country. But healthcare workers experience more violence on the job than any other profession. And that includes police officers, firefighters, and I'm assuming corrections officers. So that's a very sobering statistic. It's really hard to think about that. The first incidents of violence on the job I saw was when I was a nursing student. I'd gone to shadow in the emergency department, and I came to nursing as a second career. So I was in my 30s, not in my 20s. So, a little bit of life experience under my belt, but still a patient came in who was having liver toxicity, and so sent a lot of ammonia to his brain. And he was not in control of his behavior, but he was agitated and out of control and ended up just hitting the nurse. And I mean, not like an all-out punch, but hitting her in the face. And I couldn't believe it. And I'd been shadowing her all day. She was a really fabulous nurse, and I just looked at her and she said, "It's fine, it's nothing." And then 4 security guys came in, locked the guy down in 4-point leather restraints, which was probably needed, maybe. But nobody went to her and said, "Are you okay? How about you just sit down for a while? Let's talk about what happened. Let's file an incident report. Let's think about how we could have handled this differently so you wouldn't have gotten hit." Nothing. And so here's me, older, not just in my 20s, newly out of college, but what I'm learning is you can get hit as a nurse, nobody cares, and you're supposed to say, "Oh, I'm fine. It's part of the job." As far as I know, there are not strict policies in place to prevent this kind of violence. There is legislation being proposed. The American Nurses Association has for several years been highlighting this issue. But like so many issues in healthcare, what is the right thing to do butts heads with the inertia of the system, and the system is so single-mindedly focused in so many instances on the bottom line that there's just not a lot of effort that goes into making sure that nurses are safe and other healthcare workers. But again, nurses are the biggest group of healthcare employees. So that's really, really sad. And I can give another example. I was taking care of a patient one day, a young woman in her 20s. This was when I was working in oncology and bone marrow transplant. And her dad was angry about something that was going on with treatment. I don't remember what now. And he said, "If they don't take care of my daughter, I'm going to have to bring my gun in here and start shooting people." And thought, went out in the hallway, told another nurse, and she said, "Theresa?" And I said, "I need to report that, don't I?" And she said, "Yeah, you do." So I did, but essentially nothing happened. I think they sent up security to talk to him. Security didn't even talk to me. Nobody came and reassured me. And, this was several years ago now, but can you imagine now when we have a mass shooting every day, it seems like, they didn't make him leave the hospital. As far as I know, they didn't really sit down with him for a long time. They really didn't take it seriously. They didn't. And they also didn't take my feeling of threat seriously. I have a friend who's a lawyer, and I told her this story, and she said, "Oh, so they walked him out of the hospital, right?" And I said, "Oh, no, no. They left him there." And then he brought up with me, basically, why did I tell on him? And which he was polite about, but I said, that's my job. I have to report a comment like that. That's part of what I'm required to do, which he seemed to understand. And I don't think he was really intending to come and shoot up the hospital, but how did I know that? How did security know that? How did anyone know that? So then that's the message I'm left with, right? We don't really take your safety seriously. We don't take threats seriously. And that could be partly they're so afraid of offending people. Someone pointed out after one of the recent shootings in a hospital, so many places you go now, they have metal detectors. Hospitals won't do that. And they say it's because they don't want people to feel unwelcome. They don't want people to feel like they're being scrutinized when they come to the hospital. Well, okay, but what's the message then to healthcare workers? We don't really value your safety. I hate it that we live in a world where we're talking about needing metal detectors at hospitals, but pretending that is not the world we live in does not help. The questions about nurse staffing and the connection with violence are really important to ask. I just finished a book called Invisible Women, which talks about how women get left out of all kinds of data sets. But this author made the point that low nurse staffing, and it's relevant to the book because vast majority of nurses are still women, but low nurse staffing contributes to patient violence. And I can spell that out for people. If you think of someone in the hospital, they're vulnerable, they're afraid, maybe they really need something. Maybe they're in a lot of pain and they've asked their nurse for pain medication, and that nurse has more patients than he can handle. So it takes a while to get back to the patient's room. Well, now they've been in pain, which makes people angry. They feel ignored and neglected, and they become violent as a result. It's not hard to imagine how that happens. And it could probably be something like pain. It could probably be something like waiting for ice cream when you have a sore throat. It could probably be anything. And the point is, every nurse has a sense of priorities in her head. And someone's Jello is not going to be at the top of my priority list if I have somebody who's really, really doing badly physically and they need me in there. Or maybe someone who's just incredibly upset because they just got terrible, terrible news. But that person waiting for their Jello, they don't know about that person with their bad news. All they know is I am waiting and I am waiting and I am waiting, and my throat really, really, really hurts. And I want this Jello. And I'm using the example of Jello because it sounds trivial, but it's not. And so the point isn't to sort of like put a chart in every patient's room that says, if you're not getting your Jello, it's because something more important is happening and you need to suck it up. The point is to have more nurses so that even when a patient is really sick and not doing well and needs a lot of concentrated care, the little things can still happen. People should not feel when they're in the hospital that they're helpless and in prison. They need to feel cared for.